Hello everybody, my name is Shiva Ravindra. Welcome to my YouTube channel. So this work is mainly I am going to explain you 100 important interview questions in 100 minutes. Okay, so this is like short videos. So whenever you want to appearing in an interview or you want to go to any interview, just listen this 100 question so that you will get an idea what are the questions they may ask you, so how to answer those type of questions. So I am explaining in this video. So the question number one. So first of all, the resume is most important. How to prepare your resume? What are the content need to be present? So if you are going to attend an interview. So here you can see the resume. It should be like this. So name, email ID, and mobile number. So you need to mention the professional summary. So how much experience you have, as well as so what are the things during your experience, or whenever you learn some base and advanced SAS training. So what are the content you have learned? So those only you need to display in this professional summary. So for example, if you are putting some efficacy related stuff or any procedure related, just mention what are the procedures you have and whenever they ask the question about the process, you are able to speak at least 2 to 3 minutes about the procedure. Otherwise, please don't include. So nobody, not knowing all procedures, right? So that is why what I am telling you, what are the content that much only sufficient for resume, because interviews people don't have any other document to ask your questions. Only the document they have is your resume. What are the content you mentioned, that type of, and related to that questions only they will ask. Here are some of the sample resume. So SDTM, ADAM, TFLs, phase 1, phase 2, and what are the procedures, RTF, TFLs, and so you need to mention as well as professional skills. So if you are having the knowledge on the R or Oracle or anything, so you just mention. Otherwise, please ignore this professional skills. So anyway, SAS skills right? So and you mentioned your education background as well as professional summary starts with your current working industry too. So how much experience you have, what are the experience companies you have. So just mention those, and recent projects mention. So if you are around 10 place or 5 place, 6 place, so just mention recent 2 to 3 projects. No need to mention all the projects because they will ask the questions on the recent project. So you can just mention the title and your role, and so what are the work you have done also you just mention. Otherwise, project title and role also sufficient. But you just mention about your work also fine, because some of the companies you work as a lead and some of the companies you work as a statistical programmer. In that cases, what the work you done also you can mention. Okay. So here a COVID project, and one more is the cardiovascular project, and this is the bioequivalence project, and responsibilities is like this. And you just mentioned principal statistical program or some oncology vaccine related study. So this was also oncology study. Okay. So like that you just mentioned. You want to mention the molecule name, you can mention. So you want to reveal the client information also, you can reveal. But so most of the time it is a confidential information. So just be prepare the resume carefully whenever you go to the interviews. And the question number 2. So they will ask you the question like, what is your roles and responsibility and day-to-day activities in your industry? So as a statistical programmer, so you need to mention what is your work. So as programming expertise, or any other specific tasks you done as your role. So like SDTM, ADAM, and TFL is the general scenario for all the statistical programmers. But if you are specific to any like submission team or only SDTM team or any data issues team, so you mentioned that thing. Okay. About to handle the assignment set framework, and you have to working as a validator sometimes also, right? So you have to do some regulatory method like Pinnacle 21, defined data XML, ADRG, HDRG related stuff you have done. So just mention. And statistical analysis, SAP related any documents preparation or review preparation or mock sales preparation, anything done, you just mention. As a lead programmer, if you are working, so just mention your leadership qualities as your and what are the leadership and what is the management skills you have and what is the task you have done as a leader. So you mention in that interview call. Okay. And quality assurance. So if we are working as some third party review or any so 30% of reviews are there, so that type of work you done, so you just mentioned. So overall 2 to 3 minutes you just speak about your day-to-day activities. Once get into industry, get into the office to check out from the office, like into out, so what is your work, just mention 2 to 3 lines, just well explained in a descriptive manner, so that they will understand, okay, these are the things he done. So what is their you know uh, what is their inner requirement, so if you are suited or not, they will check based upon your roles and responsibilities. And question number 3 is, so they ask what is your recent study title and what is the primary objective of the study, what is the secondary objective of the study. So like that they will ask you some question. So here some of the studies I just giving a overview about the objective and primary and secondary endpoint. So one of the COVID-19 study. So this primary objective is clinical recovery. Okay, so clinical recovery. So they are using some placebo drug, dummy drug along with their vaccine. So how much recovery was done by using their COVID-19 drug? How much recovery was done by using the placebo? They will cross comparing with this treatment whether this your treatment really effective rather than the placebo or not. They will check. Okay, that is their projective primary objective. So what is the clinical recovery they consider? Temperature should be less than 37, respiratory should be less than 24, shortness of breath and absent, and cough mild to absent are patient reported scale. Like that, criteria they mentioned. So if the mentioned criteria met or not, they will check. And here secondary objective related to the so hospitalization rate decreasing or not, number of medical follow-ups are decreasing or not, any symptoms reduced or not. Those are the secondary objective. Okay. So next project 2 is the cardiovascular related. So here they are testing or they are accessing their drug versus placebo. So some of the patients having cardiac heart attack. So this cardiac related drug is more effective than the placebo or not, they will check by using this study. Primary objective, the effect of the our drug versus placebo. So cardiac sensitivity, troponin release in the patient. Okay, this release will tell you whether the subject having the heart issues or not. Okay, so whether which one is effect, they will check whether our drug or placebo drug. Secondary objective, most of the time safety related concern like adverse event, vital signs or any heart failure related measurement biomarker. So these are the secondary objective of this study. And third project is bioequivalence and bioavailability study. So here two drugs are there. The two drugs are given. One drug is given some patient, another drug is some patient. And in the second period, vice versa. So who are taking A drug, they will take B drug. Who are taking B drug, they will take the A drug in this period too. So all the report they gather and so standard versus reference drug, they will check the effectiveness and which one is giving more effective, whether your drug or actually marketed drug, they will check whether both are equal. So those are bioequivalence and they will apply it for the uh, marketing, and if both are equivalent, so they will sell this drug into the another country. Okay. Secondary objective is adverse events and safety related. And fourth project is oncology. One of the vaccine is Merkel cell carcinoma, cutaneous squamous cell carcinoma related cancer. This vaccine is effective or not. So our objective is safety. Here the safety is our objective. Secondary objective is feasibility and efficacy related information. Okay. And here the project 5. So here So one of the Egilastin study, that is oncology related cutaneous T-cell lymphoma, their primary objective is overall response rate, safety and efficacy. Okay, overall objective response rate, safety and efficacy. Okay, so secondary objective, feasibility, overall objective tumor response rate, the exposure of medication, adverse event. So adverse event are more, so the drug is not going to approve. So physical examination, if any abnormal vital signs are there, as a find out during the treatment, so that is also problem. Any laboratory test, ECG test, all these things they are doing as a secondary objective. So these 5 projects you can also speak about thing. So your recent projects also you can add these 5 projects. So whenever they are asking, so just elaborate what is your primary and secondary objective of your studies. Specifically, sometimes question number 4 specifically they are asking your oncology project, because nowadays oncology studies are more. So if they are asking oncology related study you done, can you elaborate little bit more? In that cases you will tell. So I recently done one study. The study title is phase 2 study. That is an open label. Everybody can able to see the label, and it is multi-center. So multiple center the study was conducted with a single agent endosterin patients relapsed cutaneous T-cell lymphoma. So this is a one type of leukocyte cancer. So that WBC cancer we are doing on the whether our drug is working or not. So relapsed CTCL refer to a type of cancer that effectively on the white blood cells called T cells, and it is a primarily affect the skin. So main primary objective is tumor responsive rate. How the tumor was giving response after giving your treatment, whether completely disappear or partially disappear or stably like that only, are increasing the size of the. So that type of objective here. So overall objective tumor response rate is our primary objective. So how can we achieve that primary objective? So primary response rate nothing but complete response or partial response divided by total number of subjects. Okay. For example, 100 subjects are there. 80 subjects are getting 80 divided by 100 give you the response rate. So the response rate will give you the whether you achieve your primary objective or not. Secondary objective, so adverse event, physical examination, all this, so they are taking the data and review whether any secondary objective are deviated or all secondary objective are achieved. So finally the complaints nothing but so number of tablets given by the doctor and expected table. So 100 we are prescribing to take the drug. So 50 only taken, only 50% compliance of the subject. Okay, so the study design is like this two-stage design. So first they will recruit the 25 subjects, and if we get a proper response, then remaining 80 subjects are recruited. If they are not getting proper response, so they are not including 80 subjects and they terminate the study. And question number 5, the general secondary objective. So most of the time, everybody focus on the primary objective, but what happened? The phase 1, phase 2 studies are most of the time of safety related information. So that time, what is the secondary objective? If it is something like phase 3 or sometimes phase 2B, they have more focus on the primary objective, but secondary objective also important because adverse events are more. So even the drug giving a positive results also they are not going to approve. Out of 100 subjects, 90%, 90 subjects are getting serious adverse event. The drug is going to not approve. Okay. So physical examination. So getting abnormal systolic BP, diastolic BP information also that is not going to approve. Like vital signs, laboratory, ECG, ECOG, and so exposure study medication. All this generally considered as a secondary objective for any study. Question number 6. whom did you reach out whenever event of data issues? So sometimes, so as lead programmer or as a part of a team programmer, so you are getting so many data issues because every time you're not getting expected a data in a clean format. So many data issues are there because due to the client was not properly reviewed or CDM department was not clearly reviewed and sent to you as a raw data set. So if you find some raw data set with the missing information, so we have some tracker between this department to our department. So you just enter, open the domain and it just mention your query. So what is the issue? So here you can see 1007 subject CMTRT missing. Okay. So raw data set CM minimum concomitant medication treatment should be available. Otherwise that record not a valid record. So those type of issues you can mention in the tracker whenever the team open and so they will give a proper response and update the raw data set and we can take the raw data set and furtherly you can move. Okay. So most of the time, so there is a point of contact given in the kickoff meeting itself, whom should we reach out whenever you have data issues, whenever you have medical coding issues and statistical reporting issues and any client POC information also they given. If you are lead programmer, all the details they mentioned on a PPT and presented to you. So you have to check and you can call and you can rectify the issue and inform to the team. So question number 7. So we are doing the primary secondary objective. So what are the data sets we are utilizing to get that primary and secondary objective? So what are the ADAM data sets we are using? So I already told you the COVID-19 project we are using, so determine the proportion of the clinical recovery rate. So for this purpose, so this type of table they mentioned. So n 95% CAN plus p value. So for this purpose, so they created COVID-14 flag as well as COVID-24 or any flag. So that flag we can use and created in the ADSL dataset itself. We can add those flags, and so by using the procedures like Fisher exact method and well as this binomial exact method they are using to get the p values as well as 95% CA. So second cardiovascular related. So in this case, so many biomarker information they are using to get there whether your drug is effective rather than the placebo or not. So for that purpose, so they use the mixed model repeated measure in the ANCOVA as well as student T test they are using to get the proper p value. So of this all the parameters. Okay. And third, here you can see by using the proc mixed model, LS means and diff by using and proc t-test you are using treatment deformation, you will get the probability value of the between the cell action versus placebo. Okay, BABE, so they are using Cmax and AUC 72 in the dataset name PK dataset they are using. So that dataset containing all the information related to plasma concentration. That dataset we can use to figure it out whether your drug is effective rather than the marketed drug or equivalent to the market drug. Okay, here you can see proc mixed procedure they are using to get the p values. And fourth, oncology. So this vaccine related. So most of the time this is a safety related. So adverse event tables and laboratory vital signs tables are used to get the information which is resolving, which are reaching the primary objective or not. In the phase 5 this study, so our main primary objective is effectiveness of the patient this drug. So primary endpoint is response rate, so CRPR. So for this purpose, so we are using a chi-square test to get the p values and so treatment groups as responses. Okay. Question number 8. So they will ask you whether you have a knowledge on the implementation guide or not. So how many types of data sets are there in the ADAM? So don't tell the names of the data set, just simply tell. So as per the implementation guide, latest implementation guide, all the ADAM data sets are categorized into ADSL, BDS, OCCDS, others, and non-ADAM. So IDSL one record per subject, BDS more than one record containing parameter visit information, OCCDS occurrence data structure, so it containing so start date, end date, and some of the MEDRA related or medical dictionary related terms containing variables, and other which is not fitted these three, so they consider as the other, so which are specifically created for the study purpose only, so those are non-ADAM standard. Okay, so what is the difference between the G 1.0 to 1.1? So mainly previously 1.0, so there is no OCCDS occurrence data structure, but 1.1, so they added this type of OCCDS structure datasets.